All right, thanks for staying tuned for the final. I was watching something about pineal glands. Final episode. Talk a little bit about treatment. So, what did that look like for me? Well, my eating disorder fluctuates between overeating and undereating. So, sometimes I end up in the hospital because I can't eat. Part of that for me personally is connected to my OCD, my orthorexia, my desire to control, and my mental health gets wired in there. Sometimes my mental health goes off rails, and guess what? My eating goes off rails. That's what happens. That's why with depression and anxiety, they ask you in questionnaires, do you overeat or undereat? Do you tend to eat more or eat less? Do you tend to sleep more or sleep less? Because our mental health affects the way that we relate to food and eating. So sometimes I can get on an orthorexic binge where I'm just eating bananas and fruit and not eating anything else for a while, and I start to notice that my energy levels start to go down. I think I'm detoxing, but really I'm starving myself. So my body goes into starvation mode because that's what you do when you restrict. You eat just enough food to keep you alive, but you start to notice that you're irritable, maybe certain parts of your body hurt more, your digestion is affected. You find yourself really emotional or really under emotional because your blood sugar is all over the place. You're in starvation mode, and people can be in starvation mode for weeks. I mean, that's essentially what anorexics live in, is a constant state of starvation mode. You're eating enough just to keep yourself barely functioning, but your body is letting you know with all of these signals like, bitch, feed me, right? That's what's happening. So I would get into this starvation mode, and people would be worried about me. They'd notice that my behaviors would change. They'd notice that I was picking at my food. They'd notice people that love me, people that are close to me, because I learned to be open with them about it, right? And then people would notice and say, hey, Jay, I noticed that you're not eating a whole lot. And then I would say, do you know what? Ask for help. I would say, do you know what? Do you think maybe my friend Michelle, she's awesome and I love her. And if you're watching this video, Michelle, she would do things like cook a whole fucking plate of chicken wings for me and bring them over. Just cause I couldn't even cook them. Because my OCD would be really bad around the contamination of like salmonella and chicken, because that's a part of it. And she would cook them for me and drop them off just so I could eat. Be honest with your friends and your family if you're suffering from an eating disorder. When it comes to binge eating, I might say something like, oh, my partner will always say, you've eaten half that bag of chips. And before I get really defensive, and sometimes I still do, because I know that I'm emotionally eating, and I'll say, leave me alone, I'm fine. And then sometimes I'll roll it up and I'll put it down and I'll say, you know what, you're right. I am eating that. And I shouldn't be. Because it's going to make me feel terrible because I've already had a full dinner. And now I'm on, you get on the binge stream and you got to turn it around. You get on that wavelength and it's like literally, look, Tootsie Pop, ma, Tootsie Pop, ma, Tootsie Pop, ma, right? Eat. Behind closed doors, your little bag of goodies and your movies and your ice cream, and you're just doing it. And I'm not talking about I'm having a treat and watching a movie. I'm talking about like every day or for days this goes on for me. As soon as I wake up, sometimes I know I'm in physical pain. My body's saying, we're hurting, but the signals in my mind are all fucked up. So I'm not listening to them. I'm just eating through them because I just want that pain. Is a sensation for me that I want in some way. It signals to me that I'm feeling something. And for some of us, it's that deep. That pain is better than feeling nothing. Or it's a familiar pain that we know from childhood. As simple as it sounds, it's true. So, treatment. So, I went into this room with all these people. Not all these people, it really wasn't that many people. It starts out as I went for an assessment, I filled out a bunch of paperwork, put it in, met with one girl who was a program coordinator, and then she referred me to the physician. And then I saw a doctor, an actual real live doctor, who specializes in eating disorders. Funny that. And we did a review of my assessment, and we talked a bit about what type of eating disorder I seem to be suffering with, and what program stream might be best for me. So then I went to an orientation. From that orientation, I learned about all of the programs that are offered by the eating disorder support part of the hospital, NEDOP, the outpatient program, and I met with a nurse practitioner and a psychotherapist who helped me figure out what stream would be best. So I started a 15-week, and no, not everyone has to do the 15-week intensive program. There's workshops, there's all kinds of things around, and there's a nutritionist that will come and tell you what to eat, and what foods do what, and blah 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 blah. Anyway, so I did this 15-week program. So the first day, I'm not going to go through all 15 weeks, but basically I'll give you the synopsis. You start with identifying what's going on, as in, what's going on currently, and then you work through your pleasure list that you create as alternate things that you can do besides binge eating. Then you get to the meat, right? You spend a couple of days diving down into your eating history and how you feel about your body and how you felt about your body since this all started. That's the part that's probably the hardest, because that's where self-disclosure comes in. You have to dig down deep. And for me, I ended up crying in front of these women, and it was okay. They were lovely. I had 4 or 5 people in my group, and it wasn't as bad as I thought, but it made me realize that there's a lot of pain around how this started, right? We didn't just get this way because we just did. It's because something happened, and for me, and I just, I'm not going to get into it, but, coming from abuse, physical, mental, spiritual, and sexual, in my case, that's where my disordered eating began. So I didn't have to go into nitty-gritty detail, but I had to let the group know that I suffer from trauma, and that because of this, I felt like it linked to the fact that I was eating to deal with my feelings from that. Deal with my feelings of not fitting in because I was a bigger kid. Deal with my feelings of not fitting in because I was a genderqueer kid and a trans kid. Deal with my feelings because I wasn't allowed to talk about the abuse. So I ate food to push it down. And it gave me pleasure too. I mean, food tastes good, sugar tastes good. Watching movies and eating sugar is even better. So I had to get down to the nitty-gritty. So I did that and it takes a few days to do that, because shit's gonna come up, and the coordinators are gonna be mindful of that. So it's not gonna pull it all up in half an hour and then send you on your way. It's not how it works. So then you go into portion sizes and starting to understand portion sizes in a healthy way, not in an obsessive compulsive calorie counting kind of way, because this isn't about food, this isn't about weighing yourself, this is about love at every size, this is about eating for health. You have to start to retrain your brain, right? So you're going to have skills, tips, and tricks to use when you feel like going on a binge or a bender. You're going to reach out. You might even form your own independent Facebook group, which is what my group did, so we could stay in touch with each other in between therapy, in between the group. I love my girls. They're awesome, and I can access them anytime I want to, because we have this private Facebook group that we've created. And it helps because you have someone who understands what you're going through. Now, I'm not anorexic, so I can't speak a lot about anorexia. So it's best to call there and just find support, because I'm not anorexic. I love my food. I want to eat my food. That's the problem. The restricting part, I can relate to just a little bit, but I'm not a full-blown anorexic. I'm an orthorexic. So 15 weeks of treatment, lots of emotional ups and downs, lots of happiness, lots of meeting people, lots of getting an understanding of what's going on. So, yeah. If you're tired of being in pain, if you're tired of overeating, if you're tired of not being able to stop, I suggest connecting to this group at the hospital. It's awesome. Yes, it's a chronic situation for me. I feel like I struggle with it all the time. However, I do feel like for the first time I have skills and I have tips and I have tricks and I have support that I can utilize. And that makes all the difference, right? Going forward. Don't do it alone. You don't have to do it alone. Niagara has support services. So, until then, I hope this was helpful. Take care of yourself, take care of each other, and sleep on it, because it will be better in the morning. Thank you so much for watching this. And again, the series of self-disclosure continues, so stay tuned.